Bipolar disorder. About your diagnosis. Bipolar disorder used to be called manic depressive illness, but now we know it can occur as severe mood swings without mania. This more subtle form is called bipolar 2, while versions with full mania are called bipolar 1. At least one person in 100 has it, although it is commonly mistaken for plain depression, because people don't recognize the up phases of their cycling as much as they notice the depressions. This is a highly genetic illness. Most people who have it also have at least one close relative with a complex mood problem. It is also commonly found with other problems: alcohol and other drug use, social anxiety, panic disorder, and medical problems like migraines, irritable bowel syndrome, and fibromyalgia. People with bipolar disorder tend to be extremely bright and creative. Because it is a very treatable illness, people can function fully and normally in the majority of cases. Someone you know probably has it. Symptoms of your diagnosis. In the up phase, people often feel agitated, irritable, and anxious. It is not always overconfident and euphoric, as in classic mania. In the down phase, their depression looks like any other depression, except often they sleep excessively and feel extreme fatigue. In addition, the up and the down can actually occur at the same time, so that people feel agitated, can't sleep, but have racing, negative thoughts. If this sounds confusing, that's because it is. Making a diagnosis of bipolar disorder, unless a person has had a clear manic episode, can be very difficult and often misdiagnosed as depression. Treatment. Antidepressants can make bipolar disorder worse. The depression part gets better, but the manic side symptoms, such as agitation, insomnia, irritability, and high energy, can increase. Instead, treatment of bipolar disorder relies on a group of medications called mood stabilizers. The goal is 100% symptom control with no side effects, which is sometimes achieved by using a combination of medications at low doses. Primary care providers are learning how to use these medications, but a specialist is usually involved if available in your area. Psychotherapy is used in bipolar disorder to help people cope with this illness. However, psychotherapy does not change the symptoms themselves. Medication appears to be required for that. What to do? Learn more about the various forms of bipolar disorder. Get a second or third opinion if there is doubt about your diagnosis. Learn more about the symptoms others in your family have had, if you can. That may help with your diagnosis. Try to avoid major sleep loss, that is, staying up very late and traveling. What not to do. Do not use alcohol to treat your symptoms. It helps calm you or get you to sleep, but it worsens the cycling. Do not try to live with serious symptoms without telling anyone. That can be dangerous, and besides, someone might try to help you get help. Do not blame yourself for your symptoms. There could be many reasons you feel like you do, even if you can't think of them right now because of how you feel. When to call your doctor. If you have thoughts about suicide and your provider doesn't know. If you begin to think about how to take your life and see yourself actually taking steps to carry out that plan, go directly to an emergency room, unless you can make contact with your healthcare provider. If you have side effects from your medication, if you are planning to stop your treatment. Let's review what we have learned. Bipolar disorder does not always include mania. True or false? True. Antidepressants can make bipolar disorder worse. True or false? True. Treatment for bipolar disorder relies mainly on therapy. True or false? False. People with bipolar disorder can look completely normal. True or false? True.